Now we all know that we should be treating the cause and not just treating the symptoms, and sometimes you might have heard that phrase, finding the primary cause. And I want to do a quick teaching video today about a technique that I use that might help you in those cases where it's not so obvious. And it's based around a case I saw that it was a child, they were 12 years old, so child but applicable for your adult patients as well. And they were having this chain sensation down their one arm when they came in to see me. Now we all know we have to take a good history and we all know we have to take a good examination. And those are the two things that we can base our findings on in terms of whether we're looking at cause and whether we're looking at symptom. It's a pain in the leg. You're going to examine the back to make sure it's not coming from the back, the L3, the L4, rather than be local into the leg, etc., etc. And part of that history taking, how the person got this pain in the leg, is important. So with this child, it kind of was quite interesting because taking history of children can be difficult. And so it was like, what have you done? Well, I haven't done anything. I asked Mum, anything different? No, nothing different at all. So the history wasn't particularly useful, other than we had this vague feeling in the one side where it wasn't particularly working that well. And so we go into examination, and when we do the examination, sometimes examination isn't as easy as we like to do in elderly patients or in someone that's a lot of pain, or in this case, this child, wherever you touch them, they were kind of wriggling all over the place, and I wanted to do orthopedic tests, so bring their arm up, and it was like, they were bending it and do this, and they weren't following instructions, so it was very difficult. So the history and examination didn't elicit what I wanted. And so when that happens, what you've got to do is cut those short a little bit, even though it's like, wow, how can you do treatment if you haven't done those two? Well, you can. You get in and you start working with the body a bit more, because you're going to roll through history and examination as you do that treatment. And what happened with this child, as we started to get our hands on the body and get him a little bit more relaxed and do some harmonics and move things around, then I was able to get a little bit of a rapport going, talk to him a bit more. So what have you been doing? You've been in school this week? How did you enjoy school? Oh no, I've been on camp. And so as we start to build that rapport, the history gets better, and we find he's been on camp, and so then I can start to quiz him, not interrogation, but get this dialogue going about what he's been doing. Now we find out he's been caving, he's been rock climbing, he's been doing lots of things he doesn't normally do, and we find out he's been doing archery. Now as we're doing this, we're doing the examination, and I'm trying to get myself into this groove of what's he been doing. Okay, rock climbing. Okay, well, has he strained something? Well, that's a possibility, through this area. Then maybe we're getting thoracic outlet or something that's going on through this arm that's causing this sensation. We can do neurological testing, of course, but that can be difficult with a child as well because of the feedback. So yes, we can do that, but the history, the examination, with this kind of what's going on for this child in the framework of their change in their lifestyle and change what they've been doing the last couple of days. And so when I dig this into more, when I started thinking about the archery, I was thinking, well, okay, what do you do in archery? And in you doing archery, you pull this back. And it was one-sided, and it may not show on the camera because when we video something, it reverses this. So it was this side on the child, and it was the side of, as they pulled the bow back. And so I actually did this. I was thinking, well, how would I? So as I did this, I experienced what I was doing, and I said, well, the bow's small, or they said, no, they were really powerful bows. It was absolutely awesome. These huge power. I'm thinking, well, if I'm a child and pulling this back, it's going to lift like this, and it's going to lift the collarbone, and it's going to influence all this area through here, and it gets me into the examination more. And then I examined through here, and this collarbone had lifted hugely, and that was the key to working out what was going on with the child. And then when I worked through this whole collarbone, released this collarbone, released this through here, then we retested through this hand doing neurological stuff, but also through him doing his testing was, I said, is it different now? And he went, yeah, it's different, it's the same. So he was doing his own testing. So the key here that I want to take home in terms of this message, in terms of teaching, is that yes, you do your history. Yes, you do your examination and you do them well, but you can't always do them the way you want them to do. And then what you're going to do is roll through that history and that examination as you're doing your treatment. So you're scrolling through these, iterating through these. And you've got to put yourself in the mind of the patient. What were they doing? They were sitting here and typing for 3 hours. They were holding their baby like this as they were trying to get their shopping or open the door. They were doing some sort of wrestling and it moved. They were bowling in cricket. They were doing archery. Put yourself, imagine what it is and do the movement in yourself. And then you will get an insight into what's going on, and it often will get you to that primary cause that was eluding you.